Pierre-Mehrens, and I am talking with Dr. William Morris, president of Aoma, about his pulse seminars that are coming up this fall.
Great, thank you, Lauren.
You're welcome. How are you doing today?
Excellent.
Wonderful.
Happy to be here.
Great. So just to kind of start off, what are the 8 extraordinary vessels that you use for pulse method?
Well, the 8 extraordinary vessels is a rather large topic, and it has to do with what I call a transsystemic view of organization of communication within a human being, and it ties closely with adaptive mechanisms. These 8 extraordinary vessels in actuality describe how we relate to space at our interior and our exterior in part, particularly along the vessels of the yin way and yang way. They also govern how we walk and move in space through the Chao Mai, or the Chao vessels. And then there are other vessels that have some relationships to development at the level of the embryo, such as the Ren, Du, Dai, and Chong. These vessels have everything to do with circulatory, endocrine, neurological, and a whole host of other systems from a biological perspective that operate at a trans level.
So you can actually feel these things within the pulse when you're evaluating an individual.
That's true. Now, this method is based upon early, or rather late Han Dynasty methods as published by Wang Shuhe in the Pulse Classic in Chapter 10. There's a description of the 8 extraordinary vessels. Now, the work that I'm presenting here is a modification of that. It's rendered into a contemporary practical application that we find that is consistent and very easy to learn, in fact.
Having taken it before, I can say that I do agree that you can learn it within a couple of days. So do you find that that teaching this information helps move people beyond slippery and wiry?
Well, certainly. Slippery is a description of the status of the blood flow. Wiry is a description of the tension of the vessel wall at its surface, usually. Now, the 8 extraordinary vessels are describing a shape that takes place between 3 positions on a side. And so it's a very different conversation. And pulse diagnosis is driven by the question. So if the question is, what 8 extraordinary vessel is active in this human being at this time? It can't be answered by slippery or wiry. But it can be answered by these shapes as described by Wang Shuhe, and later refined by Li Shizhen in his Lakeside Master.
Wonderful. And so do you, have you seen great changes in ability to treat more complicated cases by getting this information from the pulse?
Complex cases are sometimes extraordinarily difficult to treat. The 8 extraordinary vessels are necessarily a reductionist system. We're asking only one question: what 8 extraordinary vessel is present? Now, I think that it's extraordinarily important to take that view into consideration in the treatment of any condition. The question is it relevant, or is it pertinent, rather, to the person which we are treating? If so, then yes.
And so part of the seminar is also going to be looking at the 6-channel pulse method. How do you layer that on top of the 8 extraordinary?
Well, Chinese medicine historically has taken numerical divisions as a tool for understanding and dividing reality. So we start with the Wu Ji, or the unified field, the Dao, and that divides into yin and yang. So we have pulse methods that address yin and yang at a 10,000-foot view, which is the carotid radial ratio, or the Jingge pulse, or the Renying Sun Kuo. It has these various names. That's at a very large view, and that's at 6-channel level. Right? then once we come down into the terrain and we start looking at the zones or the 6 divisions, Wang Shuhe also provided us a pulse method for assessing those phenomena. And often there's a high degree of correlation between the Renying Zunguo, or the carotid radial, which is what I call it, carotid radial ratio, and the presence of the 6 channels, which is essentially a distortion in the trajectory of the radial artery. And furthermore, I would say that Wang Shuhe is, as far as I can tell, the earliest discussion of interpretations of distortions along the course of the radial artery. And of course, with the 27 qualities of Li Shizhen, which is our conventional university-style practice of pulse diagnosis in Chinese medicine, right? Those 27 qualities of Li Shizhen don't consider the distortions, radial or ulnar, along the pathway of the pulse. How do we interpret when a piece of the pulse is sticking way out here? And so.
And you often will check the pulse and check in on the pulse as you're going through the treatment. What are you looking for?
When I am treating with acupuncture or manual therapeutics or moxibustion, in any type of communication directly with the body, my expectation is that the pulse will change in response to what I'm doing. It is either going to get better or worse, and I need to know what that is. So for me, treatment is an iterative process, or a reiterative process. So it is the use of the pulse is kind of like a biofeedback loop. And so I want to see that my therapeutic objective is being realized at least at the level of the pulse. The pulse also lets me know if I've gone too far with treatment. There are a host of reasons why this takes place. And it's essentially a reiterative systems view.
Okay, wonderful. What do you feel like a practitioner could hope to take away from these seminars, especially dealing with the pulse ones in the beginning?
So, I've been studying this problem of pulse diagnosis now since 1980. So that's 34 years. And when it comes to acupuncture, I find that the extraordinary vessel pulse method and the 6-channel pulse method of Wang Shuhe are some of the most efficient when it comes to selecting points that will have an effect. Furthermore, there's an extremely eloquent lineup between the 6-channel pulse method of Wang Shuhe and the acupuncture theories of Master Tung, as taught by Richard Tan or Yunwei Jie or any number of practitioners out there today. The lineup between these two is phenomenal. And so of course, as we know with Dong style, typically there's no pulse taken at all. But the relationship of the 6-channel pulse to that particular view and the way that thinking is organized is a perfect fit. So for me, the importance of the pulse in directing that type of thinking is rather large. And I find it to be some of the more important of the methods that I've encountered over the past 34 years.
Have you seen, I know you've used this method for a very long time, have you seen changes in your students or practitioners that you've worked with when they start integrating this method in terms of their ability to turn around more complicated cases or be more efficient with treatment for a patient?
There's a high level of efficiency. Using the extraordinary vessels or the 6-channel methods works extremely well in community settings where there's very brief intakes or focused intake. This type of work is imminent within those arenas. Students typically report an improvement in their outcomes. Now, that speaks to the method by which this was developed, which is what I call a participatory worldview, whereby the research and inquiry is constructed however it arrives. And in this instance, it was from a contemplative approach to classical lore. Now this was predicated on years and years and years of family lineage education in the Meng He current and the Ding family. But, and that set the framework for me to be able to understand the literature. And as that occurred, I began to use it in my practice. Then I began to teach it to students who gave me feedback, generally very positive. And then this became the fodder for articles, which were published in the early 2000s. That then material was received critical review in the public. So this is the systems of participatory endeavor take place between practice with patients and practitioners, with learners, publications with peers, and that loop is what creates the refinement of the body of knowledge that we're applying here.
That's wonderful. I know you had kind of briefly touched on the carotid and radial pulse that you use. Is that another system that you layer on top of these two, or is this something separate that you're using?
Well, pulse diagnosis is a series of maps. And as Korzybski says, the map is not the terrain. These are human constructs that we lay over the body in order to come to some kind of a sense. Even when we're talking about wiry and slippery and all these events, these are ways that humans describe an experience. And then they take that experience and render it into some meaning. That meaning is constructed into a diagnosis and then a treatment plan. This is what I call medical epistemology, or that's what it is. And so the problem of the map and the terrain is that if I have a bias towards a certain map, say the 27 conventional qualities, wiry, slippery, that is all I can see. So the problem of the carotid radial becomes extraordinarily important if we're worried about total vascular distribution, let's say, with respect to cerebral and spinal tract. In other words, if I'm worried that a person's going to stroke, the carotid radial is actually the very first method I use. If I'm worried about channel-related problems, I'm probably going to use the 6-channel method at the wrist, especially if it's in the sinews. Certain pulse methods work better for certain problems. Now, having said that, the 6-channel method is not limited by any means to the sinews. It could be extended because the whole universe can be divided into 6 as the Tao unfolds into yin and yang, and then yin and yang unfold into the 10,000 things. As that emerges, you have the large yang, the tai yang, this large yin, the tai yin, the small yang, xiao yang, and the small yin, xiao yin, and then you have the brightness of the source qi in the yang ming, and then you have the terminus or death of yin in the joy yin. So those cosmological states, both the 6-channel method at the wrist and the carotid radial speak to, because they're part of those divisions. And it's that they speak to them. It's not that they are them. There's correlative knowledge which is created by the human making the observation. So we have to always remember that this is in our head, and that we're just using what it is that can help us get to an effective therapeutic conclusion.
Wonderful. To kind of come to your further seminars, you're doing some herbal seminars that are coming up, and you use pulse diagnosis to kind of confirm the line of questioning and what the treatment will be. How do you layer herbal treatment into that?
There's an assumption in formal Chinese medical education that the pulse is used to confirm the diagnosis. And this is a problem in my estimation. The pulse is a very sensitive tool, and one of the reasons it gets relegated to that role is because it's subjective. This is actually its eloquence and its beauty. the ability to detect nuance at such a subtle level and such a subjective level is of value. The subjective must be returned to its rightful place of authority alongside the objective in order for us to have a balanced view on reality. So this problem drives the assumptions about pulse diagnosis, and given that awareness, we can then begin to use the pulse to inform our decision making at a clinical level more fully than has been the case in recent times, or even earlier times. We find historical physicians oftentimes lamenting the insufficient and ineffectual use of pulse diagnosis. The ability to observe phenomenon which a patient has no capacity to articulate is extraordinary, and by all means should be taken into consideration in the development of the assessment, the treatment plan, and the corresponding decisions about herbal interventions. This creates a new set of possibilities for the practitioner and the patient.
Wonderful. And part of your seminar is also looking at using herbs in trauma cases, post-traumatic stress disorder. How do you use that? Could you just describe that a little bit?
Sure. Well, the use of the pulse diagnosis for the treatment of trauma is both for acupuncture and herbs, because 8 extraordinary vessels are adaptive mechanisms, and the Nanjing talks about the 8 extraordinary vessels as reservoirs to prevent flooding during times of storm. Well, what's a storm? This is a neuroendocrinological storm of chemicals through the vascular supply as the person's going through a traumatic incident, and this leaves an imprint, which oftentimes recurs. So we use the pulse to understand how the physiology is at a given point in time. So the extraordinary vessels can be used to inform herbal prescribing. And there's been a long history of that, at least since the 1500s, and Li Shizhen and subsequent authors have discussed the matter of 8 extraordinary vessels relative to herbs, which is fascinating. We won't go into details now. The use of the pulse in the treatment of trauma is one where I have a message we're going to give it now. This message is that the pulse should not be relegated to a point in time during the medical interview, which is after all the questions have been performed, and then during the physical examination, the pulse is taken. This separates us from the problem at hand. The pulse should be taken when the patient is engaged in the difficult material that they're related to. As they begin to relate that material, some of the memories recur. The physiological responses to that memory are also emergent, and it is at that time that the pulse is giving the information that's necessary for treating the response to the traumatic incident. So on a very simple level, it's very interesting to see, is their current state of adaptation with the 8 extraordinary vessels the same as that which was the response to the trauma? Or not? Right. This becomes an interesting question. So if the response to the trauma, which is like a mini recapitulation during their interview, and then we let it go till the end, and then they become readapted, and then we're seeing their adapted state. So that's at the level of the 8 extraordinary vessels. All of the nuances must be taken into consideration, and they're very basic. When we're talking about herbal prescribing, the fundamentals of force, which tells us whether it's excess or deficient, rate, and depth. In other words, the state, the spatial, the form, and the time are all essential components. These are the most basics, and that gets tied to rate, depth, force. The most basic features of pulse diagnosis, and we always come back to that. My teacher, Dr. Shen, John H.F. Shen, said, you have to come back to the basics always. And we do. And from that place, we're able to make sense. When things aren't making sense, we just draw it down to those three vectors. And we want to understand those three vectors in an adaptive state as a daily experience, and the state which is tied to the traumatic incident. So, having said that, there are also very special methods for tying treatment to a specific point in time when a trauma took place. There are the use of the divergent channels, the corresponding herbal and acupuncture treatments that relate to the divergent channels, because the divergent channels are partly how we somehow compartmentalize our experience, whether it's biological or psychological.
Wonderful. Well, we're going to stop there so that we're not giving away too much from what's happening in the seminars. Thank you so much, Dr. Morris.
I hope I didn't give too much. Thank you.
If you're interested in learning more, I strongly suggest pursuing this. You can go to our website, www.aoma.edu, under Continuing Education.
Thank you, Lauren.
Thanks.
Thank you.